Molidharan, you can start now.
Can I start, sir?
Yes, you can.
Good evening to one and all present here. For the series named COVID-19 Mindsight, I am Maulidharan, IEEE student, member of Engineering and Biology Society from the Department of Electronics and Communication Engineering. On behalf of St. Joseph's Institute of Technology, I am here to volunteer for today's session. Now, I would like to extend my first and foremost gratitude to Honorable Chairman Sir Dr. B. Babu Manogaran, our Managing Director Mrs. B. Jessipriya ma'am, and our Director Sir Mr. Sasi Segar, and our beloved Principal Dr. B. Ravichandran Sir for giving this opportunity to conduct this webinar. I would also like to extend my gratitude to our Head of Department Dr. C. Jnanakausalya ma'am, Student and Staff at Student Affairs, and Dr. G. Rohini ma'am, Lab Affairs, for their ceaseless support. Now, I will be sharing a few words about our speaker. Our speaker of the day, Dr. Ashwin Karuppan sir, is a consultant in internal medicine at Clinical's Global Health City, Perumbakam, Chennai. He has 14 years of experience and his expertise includes critical care, acute inpatient care, general care of hospitalized patient, medical and emergencies, screening for anemia, antenatal health checkups, tuberculosis health checkups, and sexual transmitted diseases. Thank you, sir, for accepting our invitation. We are immensely happy to have you with us. Before we start this session, I would like to say a few instructions to be followed by the participants. Kindly post your questions in the chat box. There would be a question and answer session at the end of the webinar. The attendance link will be posted at the end of the webinar today. Now, I invite a speaker of the day to kindly start the session.
A very good evening to everyone present here. On behalf of Gleneagle Global Hospital, I am happy to be a part of this esteemed institution, especially St. Joseph. One of my brother, he has graduated from St. Joseph's Engineering College from mechanical engineering, and the other brother was also graduated from St. Joseph's architectural firm. That's a long year ago. I'd be happy to associate myself with St. Joseph Engineering College, and especially the chairman who was kind enough, and I was always seen him as a strict disciplinarian. We had a few interactions before. So it's a great honor and privilege to be talking to you this evening. So we all are youngsters. At least I'm not. Maybe like you guys are all youngsters. So it's been a great journey throughout in associating myself in educating the students for a long time, because I feel students are the ones who take home the messages to the next generation and the previous generation, because we know most of our parents are actually completely engrossed with their traditions, and the current scenario and the previous tradition and the beliefs are a contradiction in many ways. Today, COVID-19 has been a great infection, or one of the greatest that mankind has ever seen. It has taught us many things, not only infection and deaths and all of this, but it has brought the world to a stop from the busy schedule and made us analyze which is true, which is not true. How do we discuss our life? What is happening? There are many people who have gone through these infections, who have lost their loved ones, who are happy to be out of this disease. There are many such things which has been taught, out of which humanitarian has also shown its way. We have seen migrant workers who are dying because of the sudden lockdown, because of poverty, because of not giving their wages, and many reasons without food. And we have seen how people have gone to help them. So humanitarianly or human being, it's shown the best out of us. I think this was a great opportunity, learning opportunity for all of us. Today, I would be talking to you about the infection, prevention, and impact of what has happened so far in COVID-19. So, coming to the slides, are you able to see my slides?
Yes, sir. Yes, sir.
Sure. So, we all know that the first infection was started in Wuhan province, probably in December 30th. And that is the reason why it has been named as COVID-19, Coronavirus Infection Disease 2019. So from there, we had our first case in 30th January in Kerala province in Thrissur, where there was a person or a medical student who returned all the way from Wuhan province to Kerala, and that is how the infection started. It was an imported disease. It is not the disease of Indian origin. It was somewhere imported from else in the world. From there, if you see Dubai, Iran, Iraq, Spain, Italy, every country started to get affected each. And in March 17th, UK was badly affected. And many countries have crossed these places. So the first case, as it was reported, was quarantined, was treated, and Kerala was one of the first state to get affected in Indian province. But that is the last and the best state to have contained the virus to a larger extent, and that we have to salute for their efforts from their governments and from their people in containing this virus. As of today, if you can see, there are 25 lakh 89,000 people affected, out of which 50,000 have died. That is around 2.2 to 3 percentage of people who have affected have died. That tells us the intensity of the disease and the number of deaths which are happening, that this disease is a serious disease causing a lot of inconvenience to all of them. And in Tamil Nadu especially, we have around 120 deaths in an average every day starting last 2 weeks, before which it was only 80, but in the last 2 weeks the deaths have gone up. One of the reason is due to lack of early care in the health in containing the disease. The second thing is that people come delayed to the hospital, where we are unable to treat them adequately, and probably they lose their lives. So many people are under the impression that we have mild disease, we don't have to go to the hospital, we don't have to take any treatment, and it's going to get better by itself. That's a wrong conception. Anyone can get affected. We have people as young as 14 years who have died, and people who are as old as 80 or 90 years who are still alive. So we never know who is at risk. It is assumed that elderly people are at risk, and young children are safer. But in between groups, there are still a lot of things which are happening. So everybody needs to exercise caution when it comes to COVID-19. When the lockdown initially started, there were many sentiments of the patients, or for example, the people. So they had anger, they have apprehension, they have disgust, they had fear. Some people, surprisingly, they had a joy, and out of which most of the people felt positive, especially in India, that yes, we can do this, and it is time for us to face this disease. That was a great, brilliant move. And many people had negative emotions, and many people had sadness for what has happened to them. And this was a graph taken from the Asian Journal of Psychiatry 2020, which was presented. So many people ask me a question: lockdown, did it help India? Did we really flatten the curve? Was it really worth it even doing so? See, the idea of lockdown was very simple. We have limited number of ICU beds, probably 1 lakh beds of the whole country. And if you have an overwhelming people walking towards these beds, for example, what happened in Italy, what happened in Brazil, and many countries, there were many people rushing towards the hospital at the same time. And the healthcare was so flooded that we have to make a triaging on who's going to die, who is going to be alive, who gets the ventilator, who gets pulled off the ventilator. So these were the questions which arised. So the government decided by doing an intense lockdown, we can flatten this curve or we can plateau this curve where it will match our existing healthcare capacity with the case of inflow which requires admission. So that is what we were trying to do so far. By lockdown, we are not going to eliminate this infection, or even future lockdowns, this infection is not going to get contained. Once the lockdown is open, again, it's going to go back to the same scenario where it is going to spread rapidly. The idea of a lockdown was to manage the supply and the mismatch and the demand, both of it to coincide with each other so that everybody gets to get treated. The death rates are much lower than the other countries. And this is what we have been learning from other countries throughout the world. So the need of care or need of being home is because, as I told you, there is a limitation of healthcare system in India. There is a dual responsibility that we cannot go sit in the hospital. We have to work, we have to take care of our family during these lockdowns because other people cannot visit or help like in normal times, and also hectic schedule from home and work from home, which was happening in many case scenarios. So the need for home care came into picture. So, general do's and don'ts. There is nothing new which I'm going to tell you today. And it's just wash your hands with soap and water frequently, use a hand based sanitizer, because all these are completely important for you. When you go back to your colleges, you will still have COVID 19 going around. There are still possibilities that you can get infected because vaccines are not going to be available in another 3 to 4 months, at least for now. Even if it is available during this period, it is only going to be given to the vulnerable population and not to youngsters. So when you go back, all these protocols needs to be followed in your hospital until we are COVID free world, which will happen very soon. So coughing, sneezing, cover your mouth, dispose of with tissues or handkerchief. Avoid close contact with anyone who has flu-like symptoms, cough and cold. Avoid touching your ears, nose, and mouth because coronavirus infection can stay in your hands. It's an invisible enemy and it can get you affected only if you rub your eyes, nose, ears, or mouth with the infected hands. Use a mask at all times whenever you step out of the college or step out of your house, when in classrooms. So all these are extremely important. If you have breathing difficulty, if you are a COVID suspect, if you feel you have COVID, if you are caring for an elderly, if you have in public interactions, especially with the grocery stores, health workers, and cashiers, helpers, security guards, all these are extremely important to wear a mask. So, when do you wash your hands with soap and water? So, always cough, sneezing, and then you have caring for the sick patients, cartoons, cleaning your bathrooms, probably touching your animals, food waste, and then probably before, after preparing your food, after eating, and before eating, and then touching the garbage, or anytime you think you require and need to wash your hands, please do. These are certain tips which you can follow at home. You can tell your parents, you can tell your relatives on how to disinfect your home and the vegetables, fruits. These are a little bit upon how to disinfect your homes. So mop the floor daily using 2% detergent solution or 3% disinfected solution is more than sufficient. Especially door handles, lifts, railings, benches, chairs. All these has to be wiped with 70% alcohol so that the infection does not spread to each other. Kitchen, it's always fine. You can do the same routine work, whatever you need. It does not require any special care. In the current circumstances, vegetables and fruits, you have to disinfect when you buy these. So when you eat fruits and vegetables, wash them with properly with lukewarm water. If at all you want any addition, you can add salt or baking soda, or you can use a little bit mild soap in rubbing these vegetables, clean them once again with water, and then store them in the fridge before consumption. Do not take and consume these vegetables and fruits without washing them properly, because it can cause infection to everyone. So do's and don'ts on the specific groups. What happens to the domestic help? We all families are living with people of domestic help every day to clean our house, to clean the vessels, to wash our clothes. So remember that during a lockdown, no domestic help or maids are allowed during this place. During those times, please do not cut their wages, because it's of great concern. It might not matter to us if we don't get 1 day salary, but it really matters to them. That will push them to a place where they will come to your house even if they are unwell because of salary, and then they will pass on the infection to you and the others at home, and they will also not be safe. Ask them to wash their hands every time when they come inside the house, when they go out of the house, probably any time whenever they go out to get some essential products. Ask them to wash their hands more frequently with soap and running water. By this way, you educate them, you educate yourself, you educate everybody around you. And these are the ways that we can spread this awareness of COVID-19 infection. And care for kids. If you have kids at home, especially your brother's kids or your sister's kids, or anybody for that matter, we know we have many cousins, and all these will be helpful for you, because you take down the message towards them on how to teach the kids and what to do. Nowadays kids are very smart, the generations are growing, they are extremely brilliant, and I hope every one of you, whoever is listening to this lecture, is extremely brilliant and excellent in your etiquette. So do not touch your, teach them not to touch their nose, mouth, etc. And then keep them busy with toys, reading, playing games. Online education programs, of course, we all attend classes through online education programs. So keep them engrossed in that. Do not miss your classes. So ensure hand wash at least 20 seconds for these kids, because sometimes, they just wet their hands and walk out. So make sure you wash your hands thoroughly. Keep a separate towel for these kids and for you. Do not use the same towel, because if at all there is an infection, then it will circulate throughout the apartment or throughout the family, within the family. So it is better for everyone to have their own towels. If you are caring for elderly patients, or if you have elderly people at home, especially our parents who are old, or grandparents, they are our generation. They are the ones we are here for. So always think about all of them. You might think, I don't get infection. Why can't I go out? I don't get an infection and become sick. So it's all right to get infected. But if you carry the infection home, these elderly parents and elderly people around you will really suffer to a greater extent. So preserving them and preventing them from getting infected is our right. It is our particular responsibility to take care of our elderly parents and elderly relatives who stay at home. So avoid anyone who's bringing your friends to home. Avoid meeting visitors unwantedly at home. If it is essential, at least ask them not to go near the elderly patients. Keep at least 1 meter distance. Coughing, sneezing into your elbows, especially if at all you visit somebody's house. So the same applies. Ensure proper nutrition for these elderly patients. Fresh, hot cooked meals. Do not use the meals for 1 day to the other day, because they can feel sick. So hydrate them frequently. Take fresh juices to boost their immunity. All these are extremely important for elderly to stay healthy. So ask them to exercise. Even if they can't exercise, if they go to a park, ask them to walk in their terrace, ask them to walk in their staircases, ask them to do some sitting and standing exercises. They can meditate, which will improve your immunity drastically. Take prescribed drugs every regularly. Ask them not to postpone their visits to the hospital, especially if it is a regular visit where they do not have proper control of their sugars, diabetes, or for that matter, anything. If you cannot visit the hospitals, you can always do a teleconsult. But if you have an elective surgeries, you can postpone those. Clean your hands frequently wherever you touch. Monitor your health. And if you develop any infection, especially elderly patients, please go to the hospital because they can really become sick in no time. So do not touch, cough with bare hands without covering your face. The same thing is being repeated again and again for you to register these, because how important these small acts of yours are going to prevent the infection in elderly population, which are safe for you and safe for others. Do not go near the contact. If you have fever or any kinds of symptoms, cough, you have any kind of symptoms that you are unwell, please do not go near any elderly patients. Hospital routine checkup, as I told you, teleconsultation is more than sufficient. And it's not required that if your sugars are under control or if your parents are under control of the disease, you don't have to go. Instead, you can do a teleconsult. You can help them do this because you are youngsters. You know, you are a great digital era kind of generation. So I don't have to teach you what all kind of stuffs are available in this digital era. Even I might not know much about all these. So don't go out unless it's absolutely necessary. Maintain personal distance, maintain personal hygiene, do not meet friends and families. These are all the same. Now we know that we have telephones, video conferences, photo sharing, social media, Instagrams, Facebook, and whatnot. Everything is coming up each and every day. So unless there is an infection within an old age home, you don't have to bring your grandparents home. Actually, they are very safe to be there, because many people, we know now in this digital era, we leave our parents and grandparents back home in a shelter. So many people can have this kind of a problem, but this kind of a doubt, you don't have to abandon the home unless and until it is really necessary. So coming to the home isolation guidelines. Now people ask me in many ways, should we all rush to the hospital? Should we all come and get admitted if that is the one which is needed for COVID-19? Definitely not. There are home isolations where you can stay home, you can stay safe, you can stay away from others, and then you can still get treated. But for that, you have to visit the medical facility, for that matter, any hospital, and get the medical attention first of your risk of getting sick. And then you can stay home. So home isolation and self-isolation is possible according to the government itself. So if you are a caregiver, if somebody is unwell at home, your parents, your mother, your father, or somebody is unwell, so what do you need to do? So the caregiver must wear a triple layer mask. And if you are in the same room, definitely wear a mask. Avoid direct contact with body fluids. That means your sweat, your cough, your sputum, and then probably your sneezing, all of that. Try to avoid most of it. Use a glove to dispose of all this, including the bed sheets and including the pillow covers, and then you have the towels, they are wearing clothes, everything needs to be disposed of, because all these can cause infection for you if you are going to care for them. So use a disposable glove. Always undertake hand hygiene. Clean your hands, wash your hands with soap and water, or use a hand sanitizer before and after caring for the sick. So the caregivers should also pay strict attention when you have hygienic practices while doing food, before eating, using the toilet, and whenever your hand looks dirty, please go and wash them. Avoid cigarette smoking is completely a bad idea, especially sharing these cigarettes can also cause COVID-19 infection. So that's great news to you guys. I'm pretty sure you're all good people, and we have all done this in college, but I think that it's a very, very bad idea. And if at all you have this habit, you are at very high risk for COVID-19 infection. Smoking and drinking is definitely injurious to health. This is not only as a doctor, but we also see as a friend and tell you that this has to be stopped. So sharing these cigarettes, buds, and eating from the same plate and having too much of this interaction with friends can also cause you and expose you to infection. So please make sure all these are avoided at the maximum. Patient must isolate themselves and stay away from other people. So coming to the do's and don'ts for the patient. If you are a patient, then what should you be doing? These are the ones which I told you that if you are caring for the elderly patients. But if you are a patient yourself, then always wear a triple layer mask, even while you're sleeping. It's much better because the room air will not be contaminated when the other people enter the room. 8 hours once, at least change the mask, because we all know that as we speak, the moisture content as you breathe is going to increase. So we need to change these masks when it becomes wet. Stay away from elderly patients, especially your parents, your grandparents, away, and anyone who has hypertension, cardiovascular disease, or renal disease. Please stay away from them. Don't even try to go near them, because they can contract this infection and they can really fall very, very sick. Mild and pre-symptomatic patients, please drink a lot of water, stay hydrated, and as I told you, cover your face, nose, mask, all of this as possible, so that you do not spread the infection, and maintain respiratory etiquette at all time. Do not visit any other's house. Do not encourage anyone to come near you, and maintain social distancing. And if at all somebody has to talk to you, your friends, if they want to help you, they can always use messengers, WhatsApp, and whatnot is available in this digital era. You can always keep in touch with them. So the last most important point, what should you do if your neighbors get infected? Your friends are getting infected. You have an infection in your hostel, or for whatever reason for your neighborhood, because now this social stigma is there, that if you have a COVID-19 infection, you have to treat them as untouchables. You don't talk to them, you talk about them in the WhatsApp group, and all these kind of panic situations are happening. There are 2, 3 reasons why this is happening. First, you are not properly educated on how this COVID infection is spread. The second one, probably you are too afraid and trying to defend yourself in the community. The third one is like basically bullying each other. So that's what it is all about. So we should be compassionate towards these people. We know that COVID-19 infection is a respiratory infection. We cannot escape from this. At least once or twice, or maybe somewhere there are chances that we can still get infected. Until the vaccine is available, anyone and everyone can get infected. It can happen to you, it can happen to somebody next door, it can happen to your friends, it can happen to your loved ones, family members. So we all should understand that nobody wants to get infected with COVID-19. It's just that it happened. So it can happen to anyone. It does not see caste, it does not see religion, it does not see anything. It can affect anyone equally. So be compassionate. Do not panic if somebody says that I'm COVID-19 positive. And COVID-19 positive, 14 days after the infection, they are perfectly fine. They don't have to, need not necessarily pass on the infection. There are many instances where people feel ashamed, people feel discouraged if they say they are COVID-19 positive. Definitely not. So I think that we should be very compassionate towards others. Have a good dialogue with these families. Talk to them, help them if it is necessary without any physical contact. There are many things you can do. So you can cook food for them. You can help them buy their groceries. You can help them buy their food. You can help them buy their medicines. There are many things as youths, as the younger generations, you can do many things for the society, especially for the needy people. There are many elderly parents who are living alone. where their sons, daughters live far away from here. So, you younger generations are less vulnerable to these infections. You guys are more sensible. So, I think you should take the lead during this time. If you help them, the world will appreciate you, the neighbors will appreciate you, and everyone will appreciate you for what you have done. So, I think all the youngsters needs to take the initiative, at least to help your nearby neighbors, nearby people. It is not new to us. We have had this during the flood season. We know how much we supported each other, how much we have been humanitarianly connected. And we just consider this pandemic as the same as that. So we should be humanitarianly considerate towards our neighbor rather than being and living in fear and trying to disguise yourself and others. So encourage the person, ask them to call the family helpline or national helpline where it is available everywhere. Even the local languages are available there. They talk to you. If you have any doubts, they can clarify at any point of time. Advise the patients to be isolated in the form of isolation from their family members. Encourage the patients to follow home quarantine guidelines. These guidelines are available over the internet. You can just download them, practice them as per, and then you can be safe at home, safe and secure at home. And inform and encourage these families living next door also to home quarantine themselves, not because they will get infected, but because you are using the same areas, same lift space, especially when you live in an apartment, same hand railings, same door knobs. So all of this can cause infection. So just to make sure you're all right, at least you can quarantine yourself for a few days to make sure that everything is all right. So, with this, I would like to make an appeal to all of you to help each other. COVID 19 is going to be over very soon. There is a data which says that COVID 19 is going to come down within 2 to 3 weeks. Probably within 2 months, we should be through of this infection by different type of models and researches which have been predicting. And vaccines, yes, vaccines are going to take time. They will come, but yes, it's going to take time. Probably it might not be available for the current reason or current season. So probably we should be safe, secure, help others, and then you're the next generation. Don't be a little bit lethargic in your attitude, because helping others and especially saving our elderly is our pride, and we should all follow that as quick as possible. Thank you all for your patient listening. I would be happy to clarify any doubts if you guys have. We can clarify all the doubts.
So thank you, sir, for your stimulating and fruitful words.
Thank you.
Now let's move on to the question and answer session, sir.
Sure.
Participants, you can post your questions in the chat box. So first question,
Sure.
what are the carriers of corona carriers? What are the corona carriers?
Corona carriers in the sense, where do you get these infections from?
Yes, sir.
See, the infection is only human to human so far. There are no animals to human transmission so far reported, or it is not due to mosquitoes or any insects. Only humans to humans can infect us. So carriers, in the sense, I also assume that you're asking me what all can cause this infection. Yes, anything and everything can cause. Your telephones, your mobile phones, even your doorknobs, your lift switches, anywhere. If there's an infection person who sneezes, coughs in his hands, and then it touches over all the places, everywhere it is infected. At least for 2 3 days, the virus continues to stay in these areas. So that is the reason why we tell you that you are struggling with an invisible enemy. So probably we should be very careful in washing our hands. If you continuously wash your hands, there is less than 5% chances that you will get this disease.
Thank you, sir. So next question. when should we approach hospital for this pandemic, sir?
See, whenever you have a fever, you feel discomfort. Since you guys are young, so you can wait for 1 or 2 days. Or if you feel very discomfort and you're not feeling better, please do come immediately to the hospital. And we have a separate OP for COVID patients, separate OP for normal patients. So there won't be any mixture of each other. We can assess you, we can teach you what to do, and we can help you and guide you for this. So that will be much beneficial. By that way, we can assess your risk of you require admission or you can go home. Don't come with an intention that you will be admitted, because we have home care packages introduced also, where you can still be at home, continue to be monitored by the doctors and nurses regularly, and if at all we require, we can call you in anytime. So don't worry about admission process. It's not that anyone who has COVID-19 needs to be admitted, especially young people. Definitely no need for any admission at all. We can assess your risk and uh, tell you what we will have to do.
Thank you, sir. Okay, the question and answer sessions are over, sir. Since you were very clear with your thoughts and your explanations, everyone, there is no questions more, sir. Now, thank you, sir, for answering all the questions promptly. Now it's time to express my gratitude to all behalf of EC Department, St. Joseph Institute of Technology, and St. Joseph Groups of Institution. First and foremost, I thank our guest speaker, Dr. Ashwin Karuppan, sir, Consultant Internal Medicine, Clinicals, Global Health City. Thank you, sir, for finding time and giving information on COVID and how to deal with it on despite our on your busy schedule. Thank you, sir.
Thank you. So I will also give my telephone number. So if you guys have questions, time you can WhatsApp me. I'll be glad to respond to all of you.
Yes, sir. It's a pleasure. Thank you, sir.
Thank you. You can
I'll
leave the session.
I'll take on it to vote of thanks, sir.
Sure.
My heartfelt thanks to our beloved chairman, sir, Dr. B. Babu Manogaran, for his consistent upkeep in conduction of this webinar. My sincere thanks to our managing director, ma'am, Mrs. B. Jessipriya, and our director, sir, Mr. B. Sasisekhar, for their guidance in conduction of the webinar. I would like to express my gratitude to our principal, sir, Dr. P. Ravichandran, for his support to conduct this webinar. I also thank our head of the department and IEEE chapter advisor, Dr. C. Nyanakausalya ma'am, staff and student affairs, and Dr. G. Rohini ma'am, IEEE coordinator, head of lab affairs, for their words of encouragement and guidance. Also, I take this opportunity to thank the entire fraternity of St. Joseph's Institute of Technology and St. Joseph's Group of Institution for making this event a memorable success. Finally, I thank all the students, faculties, research scholars from India and other countries for their active participation in this webinar. Our, our next webinar will be presented by a passionate Dr. C. Kishore Kumar, Siddha Doctor, tomorrow at 5 p.m. Thank you all. Have a good evening.